Let's turn now to Dr. Ebony Hilton. Dr. Hilton is an associate professor of anesthesiology and critical care medicine at the University of Virginia. Dr. Hilton, let's just start there with what we heard from Stephanie. This different reality depending on where you live in this country. Places like New York City and Los Angeles opening up with high vaccination rates, and other places like that county there in Florida that are having to shut down. Are we at a point now, Dr. Hilton, where everyone who wants to get the vaccine, they've already gotten it? I mean, this continued campaign to try and convince people. Are there still folks left to be convinced to get it?
I think there are still folks left that are vaccine curious or vaccine hesitant, but I also think there are still folks that are vaccine denied. I do not think we can turn our eye to the fact that we still have limited access to many people, particularly in those rural communities, right, in those underserved populations. So we have to be hyper vigilant about reaching them. But to tell you the truth, seeing that Foo Fighters concert just gave me hives, because what we know is that the TSA, I think they reported 2 million travelers yesterday. People are coming from those areas that have low vaccination rates, that are seeing upticks in this Delta variant in their community, and they're traveling to go to those concerts. And what we know is that we have breakthrough cases even for those who are fully vaccinated. If you look in the UK, they're seeing people pass away who were fully vaccinated. We cannot let our guards down. And I know people are tired of COVID-19, but COVID-19 is not tired of us.
So am I hearing you basically say that these large events that are starting to come back, sporting events, concerts, Dr. Hilton's not going?
I'm not going. And the reason being, if I'm going, it's definitely going to be outside. And if I'm going, it's definitely going to be with a mask on. What we know is that this Delta variant is more transmissible. We see a 60% increase in transmissibility. We know that it's having more severe symptoms. We can look at the UK that's showing people are getting hospitalized and it's younger ages. What we're seeing in the UK is that if you're less than 50 years old, you're 2.5 times more likely to be infected than if you're over 50 years old. So what does that mean as we're starting to open up our country? And we look at things like the Olympics being held in Japan, where they only have 6% of the Japanese population vaccinated. And we're flying people from all over this world to go to that area. It is very risky. And at a time that we don't have herd immunity anywhere, particularly, but in the United States of America, to risk things that we don't have to risk, I feel it's jeopardizing our lives. And it's not worth it. Honestly, we just need to take a step back, get vaccinated if you have not been vaccinated, and allow ourselves to get control of this virus before it actually controls us.
There also seems to be a bit of a strategy shift taking place as well. These mass vaccination sites starting to shut down in places like New York, in Massachusetts as well. Instead, officials are focusing more on pop-up clinics in targeted areas. Is that the right strategy right now, Dr. Hilton?
I think the more clinics we have, the better. I think we have to realize that it's not only the where the location is, but the time too. If we have persons that are working 2 and 3 jobs and we only have vaccinations offered from 9 to 5, that is not accessible to them. And we have to be real about that. I think other things that we need to start thinking of is meeting people where they are. And if that means meeting people in schools for our children and having school nurses or having, medical doctors go out and vaccinate these children there, that's what we should do. The last month that children have been allowed to be vaccinated from 12 and up, we see that they're 25% of the vaccinations that we're having right now, but it's not shared equally. Down south, less than 10% are for the children. And so we're going to run into a real problem, I fear, if we don't keep up with the vaccination rate that is at 360,000 a day when we're hitting 2 million back in April. It's a dangerous situation, a dangerous game that we're starting to play.
Dr. Ebony Hilton also introducing a new phrase into this pandemic lexicon, vaccine curious. That was not one I'd heard before. Dr. Hilton, thank you, as always, from Tech.